over to Glenda to introduce our speaker for the night. Glenda?
Good evening, everyone.
Good evening.
Can you all hear me good?
Yes.
Nice. It's my pleasure this evening to welcome Mistress Virginia Asin-Oostburg. Virginia Asin-Oostburg is a Rotarian for over 15 years. She is married to Ronald Asin and has 3 children, grown-ups, and 1 granddaughter. Her oldest daughter is also a Rotarian. Virginia is a physical therapist and physician by profession and holds a master's degree in public health with concentration in health organization and planning. After working almost 18 years in private practices, she switched to administration in 2002 and has held several governmental positions in Suriname, such as National Program Manager for Non-Communicable Diseases, Head of Planning and Deputy Director of Health at the Ministry of Health. From 2011 to 2017, she was the Chief Medical Officer and the Head of Collective Prevention Services for the Ministry of Health on St. Martin. From 2017 to 2019, she was the Director Surveillance, Disease Prevention and Control at the Caribbean Public Health Agency, CARPHA, in Trinidad and Tobago. Virginia joined the Rotary in April 2004. Although she was a bit hesitant to join the Rotary, she was hooked from the first meeting and still is. She has served in clubs in 3 different countries of both District 7030 and 7020. From 2004 to 2011, she was a member of the Rotary Club Paramaribo Central, where she served in the board as youth director and as chair and/or member of several community projects. One of the most successful projects from that time was Foston Pray, a project to stimulate physical activity in youth by bringing back yard games of the past. In 2011, she switched from District 7030 to 7020 when she moved to St. Martin. There, she joined the Rotary Club of St. Martin Sunrise. In her 6 years on St. Martin, she held several board positions such as Vice President, Secretary, President and Disaster Preparedness and Response Chair, and has initiated and participated in many community fundraising projects, combining her public health work with her Rotary service. In her year as president, she initiated a very prestigious project to introduce eye screening for diabetics and persons with hypertension for early detection of retinopathy by donating a retina camera to the White and Yellow Cross Foundation. The project was a joint venture between clubs of District 7020 and 7030. With this project, she introduced eye care specialists from Suriname to the St. Martin Medical Center and trained local technicians and healthcare providers in respectively correctly taking retina photos and interpreting images for further actions and/or referrals. This initiative has been maintained and is now a structured program at the hospital where the Suriname eye care specialists are now part of the staff of the hospital. In 2017, she was awarded a Paul Harris Fellow for her work on St. Martin. When she moved from St. Martin to Trinidad in 2017, Virginia again switched back to District 7030 and joined the Rotary Club Central, Port of Spain. Due to her work, she did not hold any position at that club. Virginia has been and still is an advocate for children obesity prevention intervention since 2009. It was when she met DGE I hope I pronounced the name correct, Lisa, in 2017 while on duty traveled in St. Lucia, that she spoke to him about this initiative, which has now become a reality. And Virginia, I need you to explain to me how to pronounce that special name when you get a chance. Virginia is now a member of her first club again since July 2019 and is the district lead for the Childhood Obesity Prevention Project 2020-2021. Please help me to welcome Mrs. Virginia Asin-Oostburg.
Thank you, Glenda. Thank you for
You're
the
welcome.
introduction. And what do you want me to pronounce?
There was a special name that I think it's maybe a Surinamese name, I'm not sure.
District Governor Lyle? Oh no,
Lyle.
Foster-Pre.
No, Lyle, that's it.
Oh, Lyle, okay.
Lyle, okay, thanks for that.
He's the district governor of 7030.
Okay,
Well, again, thank you. And for me, it's always a pleasure, and I grab every opportunity I can get to
you're
be
very
at the
welcome.
meetings of Sunrise. So thank you. Also, thank you to President Dolly for allowing me to give this presentation today on COVID-19 vaccination, which is such an important discussion, not only because of the pandemic itself, but because of all the uncertainties that are surrounded with this vaccination and with this vaccine. So I think it is very timely that we are having not only this presentation, but also I hope we will have some room for, I continuously say, positive discussion, because COVID-19 in itself has been surrounded by a lot of negativity. Persons still believe that it does not exist, and try to ensure persons that it's just a way to control humanity. And 2 weeks ago, I got another information that it's not only to control humanity, but also to control Blacks. So how crazy can it get? And the same is surrounding the COVID-19 vaccine. And for everybody taking the decision to take the vaccine or not, it's an individual choice. But then it is important that when you take the decision, that it's a well-informed decision. So that's the reason why I am giving this presentation. And it's not the first time that I'm doing this presentation. I have given presentations for other groups, and I am very happy that I have now the opportunity to give this presentation to my own Rotary family here on St. Martin. So I will now share my screen with you, and I hope you can see my screen. Just give me a thumbs up if you see the screen. And I'm trying, yeah. Yeah, everybody's seeing the screen? Okay. So what we're going to do today is I'm going to talk with you about the development around COVID-19 vaccine. And I do have to say that this is not my presentation. I have permission from the World Health Organization through the Pan American Health Organization to use this presentation that was developed by the WHO to share it with communities, with persons. So what we will do today is I will spend a few slides on just touching up on the global situation. In the before the meeting, we had some informal chats about how serious it is, and our fellow from the UK explained the plus 100,000 cases that have been tested positive in the UK. And then we will spend the majority of the time to talk about the vaccine. And I will share two final slides with some guidance and resources for the persons who are interested in doing their own research. The current global situation, although the data that, and I review the data every day, you gradually see a decrease in numbers in some of the countries, and for instance, in the United States. But although in some of the countries you see a decrease, we still have a huge number and is still an increase of numbers of cases globally. As of today, we almost are at 100 million cases from since the pandemic started in December 2019, and we are already over 2 million deaths, over 2 million deaths around the world. And although all countries are affected, these four countries that you see here on the screen, on the left of the screen, you see four countries with the highest number of cumulative cases. So that's all the cases counted together from since the outbreak started in that country. And on the right-hand side, you see the countries that have the highest numbers of deaths. In this chart, what you see is the situation. This is a chart that shows the situation on cases, and the cases again cumulatively, but as of the 24th of January up to now. So this is when you look at the different bars. The bars will show you the cases. So the bars depict the cases, and you will see that the green bars are representative of Europe, and the yellow bars are representative of America. And those are the two regions in the world that have the worst numbers of cases. And for the Americas, we know that the majority of the cases come from both the United States and Brazil. If you look at the black line here, this black line depicts the number of deaths. And that goes kind of the same trend as the number of cases. And again, the number of cases globally also still show an increasing trend. You see a sharp increase in November last year. And although it looks as if this is flattening, we don't know. We will have to see what is happening next week and the days beyond. This is a map of the situation today, as of today. So this is what you see today. If you look at the different nuances of color on the right side, you will see the locations where you have fewer cases, and the darker the shade, the higher the number of cases per day. So this is what the situation is globally today. And again, we already know about the United States. Those are the important ones for us. It's very close to the Caribbean region, and also look at what is happening in Brazil. So those are the locations where it's very bad. And you can also see Europe, the same shade of dark blue as you would see for the United States. This is a global map of the number of deaths, which is kind of the same situation. You also see the deepest shade of orange. Also in the United States, in Europe, you will also see that. And look here at Brazil. So that's the situation as of today on the number of deaths in globally. So if you know that, and if you have followed some of the discussions on how will we be able to master this pandemic, then this is the response that will immediately come up, and that immediately came up very early last year, when it became clear that the pandemic would be very difficult to halt, looking at the spread, looking at the level of infectiousness of the virus, how easy it was spread. It was already clear that being able to master the pandemic would be dependent on having vaccines available to help us do that. So not to replace what we have been doing, but to also contribute to being able to halt the pandemic. And it is not because we just think that would be the best way, but for many, many years, tens and tens of years, we have been using vaccines to be able to control infectious diseases. And I am almost certain that many of you with children didn't think twice. When the children were born, they had to go to the clinic, go take them to the baby clinic, because they have to go for their shots. And that is, the shots are vaccines. It's the vaccination program. And because of vaccination programs globally, the world and the public health international organizations were able to help limit the spread of a lot of diseases. And most of them we know, because we know when we take the child, oh, they will get their rubella today. Oh, they will get their polio today. Oh, they will get their, you have their book, the schedule. So you don't think twice. That's what you need to do as a parent to protect the children, because vaccines can prevent infectious diseases. And we have the experience of preventing diseases for many, many years, including yellow fever. The way vaccines work is that you need to be able to vaccinate a large group of people. And the reason why you need to be able to vaccinate a large group of people, the more people you vaccinate, the more difficult it is for the virus or the pathogen to make people sick. And the more people are protected against that pathogen, the more the community is protected. And that's why they call it also community protection or population protection, or in more technical terms, we call it herd immunity. And herd immunity means that when the herd is immune, you have 10 persons, 9 persons are immune to a disease. When the disease comes, the 9 people don't get it, the 10 person, whether you're vaccinated or not, because the 9 don't have it, you will not get it. So that's how herd immunity works. And how does the COVID-19 vaccine works? You have different ways of developing vaccines. And what many of the vaccine producers have been doing, they have identified that part of the virus that you can use to create the vaccine, and that the body will be able to attack, so that when the body is trained to attack that particle, it creates immunity. And that part of the virus is called the spike protein. And many of the vaccine producers are focusing on this spike protein to develop a vaccine. So when you have a vaccine and it's developed based on that spike protein, and the person gets vaccinated with that, the person then thinks that that virus is in the body, prepares, attacks, develops all the cells that are necessary, the lymphocytes and all the different immune suppressive cells that are needed. All of them are like soldiers, are recruited to attack the spike protein, and they will remember it. So the next time when the virus wants to enter your body, the body recognizes that spike protein, attacks it, and the virus is then eliminated. So that's how the different vaccines are being developed. Most of the discussions that we've seen in the news or on social media are questions about safety. How safe are those vaccines? And although the vaccine hasn't been around for very long, given the rigorous requirements for companies to get the permission to develop the vaccine, we can safely say that they are safe. We can never give a 100% guarantee, but then nothing in life is guaranteed 100%. But if you look at the safety requirements that are needed for a company to get the green light to produce a vaccine, then we can rest assured that by the time a vaccine is being made available to give to persons, then all safety measures have been looked at and have been put in place and are uh, and all the companies are in compliance with that. But it doesn't stop at the go ahead to produce, the go ahead to give. It also goes after that, because after a vaccine has been released for use, there is a program. We call the program on St. Martin ASAFI. It has a different name, and the name skips me at this point, but we call it ASAFI, and that's a program where every be it a challenge or whatever, everything that someone will notice after having received a vaccine is being recorded. So it can be anything that someone would come and say, I got my vaccine and this happened. You have to record it. And that's also in place for monitoring of the vaccine. So not only while it's developed and being released, but also the after effects after being given are also monitored. And this is what I've just discussed. We call it ASAFI in St. Martin. That's the Dutch acronym for it. But in the English acronym is AFI, which is an adverse event following immunization. So every complication, whether it's just redness at the point of where you got the injection, or some swelling, or it's hot, or you feel a little feverish, every complaint that is that is detected, you need to notify it. Then it's reported, it's investigated, analyzed. You look at what caused it, and then you get the feedback. While that process is going on, if they detect that something serious is happening with a batch of vaccine, that batch of vaccine has been put aside. Maybe you would have heard about some cases of, I think it was 13 old ladies in a home who died after receiving the vaccine. But what they were not able to show is if they died because of the vaccine, because so many persons had received from the same batch of the vaccine and nothing happened. So these are the things that are really being looked at, and you should have also maybe heard about at least 10 cases in the United States where they said that persons received an anaphylactic reaction, which is a serious allergic reaction. And then again, as soon as that is known, the batch, because there is a way of administering everything that you do, what batch is it, what is the number, how many doses were in it, how many persons were given it. So they make sure that they look at that, the batches being put on hold. They look at everything that happened around, because you need to make sure that there are no what they call confounding matters. And as soon as it is clear that it's not because of the vaccine and something else, the green light is given, and then the vaccine is given again. And if it is so that that batch had a problem, the whole batch is being removed and destroyed. So that's how rigorous the safety measures are. Another question that was also asked was, how come the vaccine can be given so well? First of all, how come it was developed so fast? I will get to that in a minute after this slide. But the other question was also, how come the trials are still going on and the vaccines can already be given? And this is what they call emergency use authorization. It's a principle that is known within public health. And in 2014 and beyond, after we had that big Ebola outbreak in Africa and the other countries, Liberia and uh, they already made use of this public health opportunity that after a vaccine is developed up until a certain period in the in the research period, so after the different stages, up to a certain point, you are allowed to use the vaccine for emergency use, because the main reason is that the risk of not giving the vaccine are far worse than the risk of giving the vaccine. And that's the reason why public health organization, after rigorous control of the process of developing the vaccine, can give emergency use authorization. So all the vaccines that are now being given are being given because they passed the test and they got permission to be used as emergency vaccines. And this is what I've been saying. The emergency authorization, although the trials, and usually it's only the third leg of the trial, are still ongoing, the benefits of the vaccine in protecting are far, far, far more important than the side effects or potential risk, because that has already been proven with the studies that they have been doing. And again, there are safety rules and regulations that all the manufacturers must comply with. Otherwise, the plug is pulled and the manufacturer is not allowed to continue to produce. So they must comply with that. I already mentioned that. So what is done to fast track vaccine development? Much of the discussion about the safety of the vaccine, as I mentioned, is about the time within less than a year that companies were able to develop the vaccine. And this is possible for several reasons. The vaccines that under normal circumstances are being used, the different trials that you have to go through, so the different phases of trial that you have to go through, mostly because of a financial limitation, are finalized. One phase is finalized, completely finalized before the next phase starts. With the COVID-19 vaccine, the phases went simultaneously. And of course, again, with rules and regulations. So if you would need X amount of money for one phase, and you have 3 phases going simultaneously, you need 3 times X to be able to produce the vaccine. And I'm going to say something which is not nice, but it is being said because it's usually the less developed countries that are in need of vaccine and they don't have the money for that. Um, the more developed countries were not inclined to donate as much to vaccine development as now, where the whole world need the vaccine. So there is no difference between a developed country or a less developed country. The whole world need it. So this is where the solidarity kicked in, and a lot of money was raised, and a lot of companies received funding to be able to go the fast track in developing the vaccine. And this is what these 2 figures is showing you. So this is just the normal manufacturing and production capacity for the standard vaccine. So the mumps, the rubella, the yellow fever and whatnot. And this is the figure that shows the production phase and up to approval, the expanded production phase to be able to manufacture the COVID-19 vaccine. So what are the different steps? Because I've been mentioning that there are different steps and that there are different phases, and that phases can go together, you can go have them simultaneously. But what are the phases? Any development of a vaccine will start with a preclinical study. So that's why you have hundreds of companies who ask for permission for a preclinical study. And the preclinical study, that's the phase where they test the vaccine in animals to see how, and they call it efficacy, how well the vaccine behaves, how well it works, how well the vaccine is able to trigger the immune system, and how safe it is. And then only after the results of the study are being reviewed, scrutinized, and seem positive, only then the manufacturers are given the green light to start with the clinical trial. And the phase 1 clinical trial, that is then the build-up phase, a phase 1, a phase 2, a phase 3, a phase 4. That's the build-up phase. You first start with a small group because now the studies will start on healthy humans. And again, you look at the results, you do the test, you look at the blood samples, how the response is triggered in the human body. And again, you look at the results, and if the results are positive, the efficacy is shown, but the safety is also confirmed, then the green light is given for the next phase. And the same goes with the clinical trial 2. Larger group, you allow persons with more and different characteristics, older persons, persons who maybe are still have a good physical health, but you can expand the group. And in the phase 3 trial, that's when you need a very large group, and that's at least more than 30,000 persons you need. And you really need to be as close as the reality of life as possible. So persons of different age groups, persons with different health backgrounds. So all of that you need to include in that clinical trial. And the phase 4, that's after the clinical trial and after the vaccine is now proven safe and has a good efficacy, you will have to test for the effectiveness in the community, and the phase 4 is then the ongoing studies. It never stops. Even now with yellow fever and measles and mumps, post-market surveillance, the ongoing studies never stop because you have to make sure that everything that happens is being monitored, and you look for adverse events. You also look at long-term effects, although it's not known with vaccines. As far as I did my research, as far as I have known for all the time that I've worked, I haven't known about long-term effects, but not because you haven't seen them ever means you should not look for them. And then, of course, there is the human challenge, which people you usually shy away from, because this is when you have developed the vaccine, persons are given the vaccine, you're now going to introduce the virus to see how the body reacts. But these are human challenge studies are hardly ever done. This is just to show you what I've been saying. This top row, that's the traditional way of vaccine development. And the bottom row is what has been happening. And this really was only possible because there was money available to develop the vaccine and to have phases go side by side. And that was the only reason that it was possible. And of course, the need for the vaccine. So it's two things. The need for the vaccine, because without the vaccine, we will not be able to control. You see with the different strains that are now popping up here and there, in Africa, in the UK, there is a need for the vaccine. Only with the vaccine you will be able to lower the cases, lower the hospitalization, lower the number of deaths. So that's why it's needed for reduction of severity, but also reduction of hospitalization, and that. This is just to show you the amount of vaccine candidates. There are more than 170 candidates in preclinical trial. Only 64 are now in the clinical evaluation stage, so the phases that I showed you, and only 22 are in phase 3 trials, and up to now, only 4 have been given the emergency use authorization. These are the ones that now received emergency use authorization, and the Oxford, AstraZeneca, the Moderna, and the Pfizer are already being given in many countries already. I'm not going to talk about this too much. This slide is just, there was a lot of talk about the vaccine infecting your DNA. And you know, your DNA is like your heritage. This is where all your information is stored. And there were some, and some of them even being my colleagues, claiming that the persons should not take the RNA-based vaccines because it will alter your DNA. This is impossible, because the RNA, your DNA is kind of captured in the nucleus of a cell. And to be able to enter the nucleus, there is a key that is needed. And the RNA doesn't have the key. So yes, it goes into the cell and it works kind of like a Xerox machine. So they introduce something which is like a paper with information on it. That's what you call the mRNA. It is introduced into the cell. And then in the cell, you have a body we call the ribosome. You would see it in here. That's the Xerox machine. So then the piece of paper, which is the mRNA, comes inside, goes through the Xerox machine, and it spits out the protein, and then it gets in your fluids. The body recognizes it, and the body makes antibodies. The fluid that was introduced, so the vaccine, doesn't stay alive because the body attacks it, so it is destroyed. But the immune response, you had the immune response, and because of the immune response, if you now meet with the virus self, your body will be able to recognize not the virus, but you will recognize the spike protein, and you will be able to again have a immune response to attack the virus. So this is also what I've just been saying. mRNA is a new technology, and in my opinion, this is music in my ears. And I do have to say, when I was in St. Martin for 6 years, I was also the expanded program on immunization manager, the EPI manager. So I had to familiarize myself and know about vaccines and how they work, because I introduced 2 vaccines while I was on the island, the pneumococcus vaccine and the human papilloma vaccine to protect young girls and young boys with the HPV virus that causes cervical cancer, and the pneumococcal vaccine that is the protection for the severe pneumonia, which also cost lives. So you really need to familiarize yourself and know how vaccines work to be able to explain. And when you realize that with this new technology, how easy it will be for in the future to develop more and different vaccines with this new technology, I think this is really, really the future. Up to now, it's really the future. There has to be some tweaks here and there to allow it also to be available for the less advanced countries, because specifically the Pfizer one, you need very low temperatures to maintain the cold chain so that the vaccine is still viable. But this is the future. Um, this is also at this point maybe not such a big deal anymore. While AstraZeneca was developing their vaccine, in their trial, they noticed that if you give 2 of the same doses, the person responds differently than when you give a little bit first and then a bigger doses later. And giving a little bit in the first dose and larger doses later had the best response. And what they now know is that when you give a smaller dose in the beginning, the preparation of the body is better, and it just boosts the body, the immune response after the second dose. While when you give 2 of the same doses, the body attacks the first doses. So it reduces the efficacy of the vaccine. Um, I already mentioned that it's a rigorous system. That's also the reason why there are so many vaccines in development. We will need millions and millions and millions of doses to vaccinate. Up to now, most of them are 2 doses vaccines. They are now also going to start with a 1 dose vaccine so that you only need 1 shot. But most of them, so the AstraZeneca, the Pfizer, and the Moderna, all of them are 2-shot vaccines. So if you know that we have how many milliard of persons in the world, more than 7, then you realize how much vaccines will be needed to be able to vaccinate populations. And it's not the intention to vaccinate everybody at once. There are priority groups that will be vaccinated. What is also important to understand, and this is also what you would have heard in discussions, that questions are being asked about the effectiveness. How effective is this vaccine? Yes, it is produced in a lab. Yes, in controlled trials, you try them out and it shows as if the vaccine is working well. But how will we know that we are really protected? That's what we call effectiveness. So the effectiveness is how well the vaccine behaves and works in the community, how well persons are protected against it. And this is still, this is also what we will have to monitor, but the reports that we have had from the different trials, that's why also in the third phase, the third trial, you need a larger group, because then you can also start looking at the effectiveness. But what we now also learn the from the vaccines that are already being given, that it carefully shows as if the effectiveness is also protective of severe disease or that. How will we make sure? Because that was, of course, the main concern of many countries, including Suriname and including St. Martin. How will we make sure that the vaccines reach everywhere, everyone, everywhere? Because if we say health is a public good and equal quality health for all, then having the vaccine should mean that all countries should be able to get their hands on the vaccines. And what was already known is that when the manufacturers started producing and you saw the promising effects of the vaccines, all the developed countries invested in the vaccine and purchased a large quantity of the vaccines. And this is where then the Cofax Initiative was born. The Cofax Initiative is an initiative between the organization that kind of oversees making sure that vaccines are being distributed equally. So there's more equity, not equally, but there is equity in that. And the WHO and another group, they came together and they made sure that they raised sufficient funds to be able to have sufficient vaccine doses available to make sure that every country in the whole world is able to receive vaccine in a way that it will protect the most vulnerable and in a way that it will help countries to reduce the number of persons getting sick and the number of persons being hospitalized and reduce the number of deaths. So it doesn't mean that every country will get the same doses as other countries or sufficient doses to vaccinate everybody in the country, but equity means that they will get enough so that protection of the community is guaranteed. This is only to show that how much money was needed, because the vaccine production of other vaccine continues, but this is much more that is needed in resource mobilization just to be able to develop the vaccine simultaneously. And because that happened, there could have been a risk that the available finances would kind of have a negative impact on the traditional development. Hence the reason that Cofax was needed to ensure that other funds were mobilized for that. So now the vaccine is here and everybody was hooray, 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 because now we go back to normal. No mask, no social distancing, we can hug, we can kiss, the economy goes open again. Unfortunately, that is not the case yet. And that's why it's important that we understand what the vaccine will be doing for us. The vaccine will not eliminate the infection. What the vaccine will do now, the vaccine at this point will reduce the seriousness of the disease. That is what it will do. And it will protect the most vulnerable so that they don't get sick, that they are not hospitalized, and that you don't have that many persons that. So the things that are needed now is for persons to understand that. For a while, and maybe up to 2022, we will still have to comply with the measures. Keep the distance, wear your mask in public, make sure that you don't hug and kiss. So all those measures will still be in place. All the hygiene measures will be in place. And that's the reason that it was also challenging for persons to say, okay, then I'll take the vaccine. Because if I take the vaccine and I still have to do all of that, why do I have to take the vaccine? If we don't take the vaccine, we will not even meet the endpoint, probable endpoint of 2022, because it will allow us to go back to normal in a way that economies can reopen. So we will still have to comply with the measures, but at the same time, we are ensured of a serious reduction of the severity of the disease. And this image is just to show what all are the considerations to that a country has to look into. So what do you need to do as a leader in the country to ensure that you share well-informed information and that you also look at behavioral aspects to promote uptake, but that you also can, how to eliminate all the risk, and how do you compensate them for the risk that they see with the new vaccine and them not being able to go back to the way it was before COVID. I'm going to skip this one. I think it's also good to know, so I'm coming to my final slides now. I think it's good to know that there's also considerable attention for training persons how to give the vaccine. And although many health workers and specifically nurses are very well trained in giving vaccinations and giving vaccines, with the COVID vaccine, since we are still learning a lot, there are also many trainings for health workers in handling, in storage, administration, because everything has to be precisely noted so that you know exactly what it is that you have to look for. And of course, the communication is important to have persons make a well-informed choice, so the acceptance and the demand. This is, well, not all of it. These are some of the resources. There are many, many, many resources out there. So for those who are interested in knowing a little bit more, if you go to the World Health Organization website, these are all the documents. Everything is there for you to look for. Also, CDC has a lot of information and many universities have that. This we already know. This will not leave us. And guess what? Some of them have been hygiene measures for as long as we live. It's only that we are now paying a little bit more attention because it's so related to the infectiousness of COVID-19. Thank you.
Thank you so much, Virginia. That was really good. I mean, we knew bits and pieces of everything, but to get all the details so that we have all the information is very, very important. I am going to open the floor to questions, and just so that everyone gets a chance, we will keep it to one question a person until the questions are done, and we can come back to that person again. That way everyone gets a chance. I see Damali has her hand up. Damali?
President, can I just interrupt just for 1 second? I just want to remind everyone not to forget their happy dollar pledges while questions are being asked. When they have time, please post your pledges and I will make a note of that. Thank you.
Can you elaborate on the happy dollar pledge? I don't know.
Sorry, Hanisha, you asked something? I missed the question.
This pledge that you're asking for, I'm sorry, I don't mean to divert anybody's attention, but I just wanted to know what the pledge was all about.
It's it's just something that we remind our members and all the attendees of meeting that we always find small reasons to be happy, and whatever they are happy for, they pay $1 for that. That goes towards the club funds. Dollar, $2, even it could be $20, $50, whatever. How happy they are, they show with their pledges.
Oh, wow. Okay, great.
Thank you.
Thanks.
Thank you, Jerna and Hanisha. Damali, your question, please.
Good evening, Virginia. Can you all hear me?
Yeah.
Okay. Thank you for, of course, a wonderful presentation. As a healthcare professional myself, I find myself giving advice when it comes to the coronavirus and the disease and how it's to be treated. Could you explain to the audience what does it mean once you're vaccinated? Because not all vaccines work the same. You can be vaccinated for something and still get sick, but then have a milder form of the illness. But does it also affect the transmission? So if we get vaccinated, will we still, if we do get a mild form of the disease, are we still able to transmit the disease to other people?
Well, in your question, you mentioned a few things. Let me start with the last one. When you have a mild disease, that is even now without the vaccine, what is already known as person who are either asymptomatic or have mild diseases, the virus count in your body is so low that the chances that you will transmit it to a person are very low. Of course, you still can, but the chances are that it is very low. When it now comes to a vaccine, you will have the symptoms of an infection, but since it's a vaccine, you do not have the virus. So you don't transmit the virus. You don't have the virus. What you have is part of the virus. That's the spike protein. That's what you have. And it mimics the virus, but it's not the virus. So you will kind of feel feverish. Not everybody. Most of the persons, because I'm also following the side effects that are being reported, most of the persons that have reported side effects speak about some tenderness at the place where they got the shot, redness, a little bit warm, but those are most of the side effects that they report. So, but what the way it works, of course, is that the vaccine comes into the body recognizes the vaccine, your immune system starts to work. You have two types of immune systems, the local immune system and the immune system where your lymphocytes, so that's from the fluids. So that's those two types. So first, locally at the place where the vaccine enters, you will have that reaction. And I always say to people, I'm sorry that you feel miserable and that you have pain and that is red, but I'm happy because what it tells me is that the vaccine was good because you have the response that you get when you have a foreign pathogen a foreign stuff in the body. And then while that is going on, the fluids, then the soldiers that come from afar, they now are developed in your in the body. That's what you call also the lymphocytes. And you have different types of lymphocytes. One is a helper one is a memory one. They now go and they support what is happening locally. And that memory stays in your body. What they still don't know yet is how long it will stay. We know from yellow fever, for instance, years, researchers thought that the yellow fever would stay for 10 years. And then after 10 years, you would need a booster. But for a few years now, we already know that yellow fever is for life. You don't need a booster. But we don't know that yet for COVID-19. What they are anticipating based on the information that they are now looking at, the data that is coming from the research, is that they expect it to last at least 2 years. But you should see it also a little bit as the flu vaccine. Every year there's a flu vaccine because viruses have the tendency to change a little bit. They don't change. So it's just like, now I'm having this shawl and I'm still Virginia, and then I take away the shawl. I look different now because I don't have the shawl, but I'm still Virginia, right? So if you look at something that would still work on me, whether I have my shawl or not, then I will still be able to fight any virus that comes in my body because I'm still Virginia. It's just that sometimes I have on a blouse, a red blouse. Sometimes I have a shawl. Sometimes I wear something with straps. That's the way a virus works. That's what we call shift and drift. When you get big changes, then it's a little bit different. That's when I go to the plastic surgeon and then I get a different nose, or or I go to the hairdresser and I remove all the white again. So, and that's also when people say, I don't recognize her. This is a different person. So those are the kind of differences. And with the the different strains that they have been identifying up to now, what they have been able to find is that since they are working with the spike protein, the vaccines will work. But they're still looking into the different strains and how they can kind of adjust the vaccine in a way that they also consider the different characteristics of the new strains. A long answer to your question and remark, Damali.
Thank you, Damali. Thank you, Virginia. Cookie and then Valda.
Thank you, President. Virginia, very nice, informative presentation you did today. I had many questions, but I ticked them off one by one because your presentation had most of the answers. But still, I have few. I would join up at least two questions together because President put a rule, one only, but at least I need an answer on two. First, do you think any like WHO or any government agencies or anyone can make this as a mandatory to take vaccine? And the other connection to it is, why is the vaccine to be stored at a very low temperature?
Okay, let me start with the first one. I do think that some countries can make the vaccine mandatory because we still have dictatorship in countries. But you know that our constitutions, most of the constitution and most of the public health laws do not make vaccine mandatory. So I am very reluctant, but if it's made mandatory, only a local government can make it mandatory. Not WHO nor one of the public health institutions can make it mandatory, nor the UN. There is freedom of choice, but my anticipation is they're not going to make it mandatory, but they're going to do everything in their power to ensure that at least the 20% of persons that have to be vaccinated before the end of 2021. They're going to do everything. They're going to use behavioral specialists, psychologists. They're going to use everything to ensure that that group is vaccinated. And those are the healthcare workers, frontline workers, priority groups, vulnerable groups like over 60s, persons with underlying diseases like hypertension and whatnot. But no, I don't think it's going to be mandatory. Um, and your second question, it's only that Pfizer one that has to be stored at minus 70 degrees. And it's just because of the platform that they're using. The type of mRNA platform that they're using in the lab, you need to keep it at that low temperature to make it a viable platform. When the Pfizer, so the same one you have to keep in stock or store for that low temperature, it still can be stored at lower temperatures, higher temperatures, like for instance around minus 4 or 5 degrees, but then only for a few days. So let's say you would get your stock and it is transported with dry ice and all of that, you need to keep it at that low temperature. When it reaches your country and your country doesn't have the facility to guarantee that minus 70 degree, you will have to make sure that from receiving to giving, you do not go beyond those, I think, 3 to 4 days stored at the temperature of minus 5 degrees. So that is still possible. That's why also what the release for the vaccine, every country has to submit their deployment plan. And only when that is received, you will get the vaccine, because otherwise it's vaccine spillage. If a country cannot show to the international organization that their logistics, their administration, their material, that everything is in place, the vaccine will not be released for the country, because you cannot guarantee that the cold chain can be maintained. But St. Martin has a very good vaccination program, and whoop, whoop, Sunrise, remember we had donated those carriers. We still have our logo on it, right? So we have supported, but of course more will be needed. So maybe a suggestion to reach out to CPS to see how Sunrise can, or Rotary St. Martin for that matter, don't make it a one club thing, make it a Rotary St. Martin thing, how they can support logistics. In Suriname, we are already getting together with the Bureau of Public Health to see how we will be able to support. And this is my way as a Rotarian also to support the vaccination program, to kind of promote acceptance of the vaccine, but also to promote sponsoring. So to get together with your public health agencies and see how you can support. And President Dolly maybe to contact Eva and to say, hey, remember I had invited the Secretary General. Unfortunately, she didn't join, but that's also a good opportunity. I hope I answered your questions, Cookie.
Yes.
Okay, Valda, and then Claudia, and then Glenda. Valda, it's your turn.
Thank you, Madam President. Hi, Virginia. Okay, going back to, I think, what you mentioned with the Mali question, from what I understood, once you take the vaccination, you can still contract the virus. The vaccination is only to prevent, the symptoms, to help you fight off the virus, where you won't have the complications that can lead to being, to in the hospital or even dying. However, you're still able to spread the virus. So for instance, I had the vaccination. I contracted the virus. I do not show any kind of symptoms because I have the vaccination. I'm able to fight it off. However, I'm still a carrier. I can then spread the virus to someone else. Correct?
Yes, yes, correct. Theoretically, yes, but
Uh-huh.
um, also with persons who are either asymptomatic or have mild symptoms. When you have that, you have a very low viral count. And when you have a low
Okay.
viral count, the chances of you transmitting are also lower, but you still can.
Oh,
Hence the reason that I said we will still have to comply with the
yeah.
different measures of protection.
Okay.
But it's correct. Usually, the intention, what we try to achieve with the vaccine, is to prevent infection. Then it enters, but it doesn't do anything. But with this vaccine, and that is ideal. Not all vaccines can do that, because you can take your flu vaccine and still get the flu, but then maybe mild. And again, with this vaccine, yes, it will prevent serious disease. It will prevent serious complication, but it will not really prevent you from getting still infected and maybe have mild symptoms.
Okay. Okay. That's clear.
Okay, Valda, thank you for that. Claudia, you're next. You're on mute, Claudia.
Sorry. Thank you for your presentation. I have one question to ask. There's something that I've been missing from, the different presentations or different things that I watch on YouTube and stuff like that. But don't you think that we should be emphasizing on boosting our immune system, regardless of whether we take the vaccine or not? It's preventative, but at the same time, it comes across as a fallacy to me to only rely on medication, but knowing that we have to do things to boost our immune system to help fight whatever virus or bacteria, or whatever the case may be. That's my
Oh yeah, but you're quite right. And I wouldn't say that there is not sufficient attention for uh, advice on boosting the immune system. I think that because the discussion is on vaccine, then the attention goes to the vaccine. At all times, whether it's with or without COVID, at all times, the public health promotion is healthy eating. Whether it is to prevent diabetes or to prevent another disease, or just to ensure that people live a healthy life. That's always the case, and that will never stop. So promotion of healthy eating is part of our healthy lifestyle. And I do agree that with the discussion on COVID, attention goes to the things that are, let me say, I was going to say important, but everything is important at some point, but things that need more attention at that time. So, and I don't think that you will never hear anyone say, neglect the healthy eating to boost up your immune system, just take the vaccine. And it's also that they won't say, don't take the vaccine, boost your immune system, then you're also protected, because that's also not the whole story. So they go hand in hand. But I fully agree with you. Maybe we should also include in presentations, and I'm going to do that tomorrow. I have another presentation in Suriname to another large group, and I'm going to include a Claudia Connor slide. Boost the immune system. Don't forget. I'm going to put that in there also. But thank you for that addition, and I fully agree.
You're welcome.
Thank you, Claudia. Glenda, you're next.
Thanks for informative presentation, Virginia. My question is, or concern, is there a minimum age for taking the vaccine?
Well, up to now, what they have been advising is younger than 18 years, that you do not vaccinate younger than 18 years old. It's not necessary. But the target groups that are now being vaccinated, and that's the target that they want to have vaccinated before the end of this year, is health worker frontliners. And usually they will be 18 or above. But the minimum age would be 18 years.
Thank you.
Cookie raised his hand again.
Yeah, but Suresh actually messaged me. He wanted to say something. Suresh? Is he
Yes, thank
on?
you. Thank you so much, Dolly. Virginia, thanks. I don't have a question as such. I just want to make a comment. In the UK, I'm also volunteering at a vaccination center. And every time I volunteer, I volunteer every Saturday from 8 a.m. till noon. And every time I go in, I have to take a latex test where they give you a swab, you put it in your nostrils, then you wait for 30 minutes, and then your test comes negative or positive. Now, last Saturday, the center only had about 400 vaccine. And we have got a lot of walk-in patient that just comes in. Now, for 400 vaccine, you cannot vaccinate everyone because the vaccine are only for the appointments only that has been made for that day. Now, we get some oddballs that comes in and said, oh, if I become a volunteer, can I get the vaccination? And we of course will say no. And towards the end of my shift, I was told by the volunteer person or the head of the volunteer people, they said that, do you want to have the vaccination? Because we are keeping 10 aside for the volunteers. So I was a bit hesitant. I told them, no, I'm not too keen yet on having the vaccination. And because I've got blood pressure, diabetes, I have breathing problems. So I'm not sure of having the injection just yet. I want to check with my GP. Then I did my volunteer work 2 days later, and another person asked me, do you want to do the vaccination? So I said, well, I got told to do it 2 days ago, and now something is telling me that I should do it. So I did it, and I got the Pfizer jab, and when I went home, I was fine, but then during the day, my arm became quite heavy from the jab. And the next day I had a heavy head. I was feeling a bit weak. My head was turning, and I drank a lot of liquids. And up to now, I'm fine. I had no side effects, thank God. And they told me that the next dose that I have to do is in 12 weeks. 3 months.
Mhm.
And I was told first that I had to do it after 21 days. And I said, I'm not too keen to do it for 21 days. I'll wait 3 months and then do it in 3 months. And I've already got my appointment for 3 months. But I tell you, doing volunteering work at the vaccination center is just an amazing thing. You meet people, you meet elderly. I even have to take the elderly in a wheelchair, take them to the center, wait for them until they get vaccinated, wait another 10, 15 minutes until the recovery time, and then take them out to their car. And it's such brilliant work involving the elderly.
Yeah.
And
Wow.
I'm so proud of it. I'm going again this weekend. And every other Saturdays they want us. And
Wow.
can you believe it? All the volunteers are Indian. There's about
Wow.
50, and they're all Indians.
That's amazing.
Yeah.
Amazing. Amazing. You know, you said you're proud.
Mm.
I am proud that you're a fellow Rotarian, because that's what we do. I feel so proud just listening to your testimonial. And, when you were saying that after they asked you the first time you were hesitant, the first thing that went in my mind, you're the exact target group that need it, But
Yeah.
and that's also goes to show that there is always divine intervention. Because why did someone walk up to you 2 days after to tell you again, do you want to take the shot? And while you listen to that voice, the two side effects, you said no other side effects, but the two side effects that you mentioned are also side effects that are being mentioned, although they are not that common, but they have that. So the heavy hand and the lightheadedness. Some persons also get headache. So I now feel so proud about your story, and I can definitely empathize with you, the feeling being there, helping persons get their shot, being part of that protection. That's the Rotary Plus Plus program that
Yes.
the
And
Polio Plus Plus.
yeah, and before I forget, I forgot to mention that on Monday, our Prime Minister visited the vaccination center.
Wow.
Nice.
Wow. Wow. Amazing.
Yeah.
Amazing. Why don't you share this as a Rotary story on Facebook? Just share it. It's a good testimonial. Rotary at work.
Yeah.
Excellent.
Yeah.
Good job. Good job.
Thank you. Thanks.
Thank you for sharing that, Suresh. It was yeah, it gave us a little bit of encouragement when it comes out to go and get it, because a lot of people are hesitant like you were before, and they need that little bit of push to say, you know what, I should go get it. Cookie, and I'm gonna make this the last question for tonight because it's already 8:50.
Yes, thank you, President. Suresh, really wonderful to hear what you just mentioned about. I just have a question on the point of Suresh mentioning that he was given an option of 3 weeks or 12 weeks. Is that really an acceptable option? Or normally what I heard was 21 days, but how did he get 12 weeks? Or that has something new added up in here?
Well,
And
that's a discussion that is still going on, Cookie. You have different time spaces in between doses, and you notice that persons are extending the time frame. So there is not much I can say about that, but the usual time frame, you have a few that give the second dose after 14 days, 21 days, 28 days. But we have been hearing, and I've been reading about it, and I don't know what the reason is. Some of them say the reason is having the availability of the vaccine, is that they extend extending the time frame between the two doses.
I
That
would just wanted to mention this to Suresh, that make sure that the 12 weeks gap is acceptable according to them and fit for you. It doesn't mean that after 12 weeks the first dose is gone to waste, then it's a no good story.
Would it be effective?
The other question which I have, if I go back on a slides which you were showing, if I'm not mistaken, I read it that people with low immune system cannot take this. Was it mentioned on your slide?
Yeah. Yeah. Well, usually with vaccines, persons with low immune systems, you do not give them a vaccine because their system will not be able to have that immune response to attack. So persons who already have, persons with cancer getting chemotherapy and whatnot, you will have to be very careful in giving them the vaccine. But the good thing is that if you have enough persons around them that get the vaccine, the chances are that they will not be exposed to the disease. But that's correct. But that's regularly with vaccines. That's why you need, if there is anything with you, you have to discuss. And Suresh also mentioned that he was going to discuss first with his physician. So that's always a good advice. Discuss with your practitioner, with your physician, your situation, and then know if it is safe for you to take the vaccine, yes or no.
Thank you.
So my last question, President, sorry.
But I see Marcelia, her finger and her hand and her shaking her
last
head.
question.
And actually, Angela
you were
also
showing the slides, phase 1, phase 2, phase 3, phase 4. Exactly at what point did the vaccination start in those phases?
Vaccination after I would want to say that after you're 2/3 in phase 3, so the third trial, after you're almost at the end, so all the information is already there, you're only tracking and making sure when you've reached that point.
So clinically, where thousands of people have been tested.
Yeah.
So in phase 3, you said it's a group of thousands.
More than 30,000 has to be in the group because it's not only efficacy, it's efficacy, safety, and effectiveness.
So clinically, 30,000 people have been tested before the vaccine has started.
Yeah.
Okay.
Before they give it public to person, so that would be the third trial.
Yeah. I got it.
Okay.
Thank you.
Angela, quick question. Angela?
Marcy.
I think Marcy, you had a question?
Joe, for the longest of time, I was trying to cut cookie so I could get my question in.
Okay, because Marcy has a question and Angela also has a question. So Marcy and then Angela. And we really have to stop. It's almost 9.
Yeah, very quickly. Virginia, I have this teacher, and this is what I wanted to brought. This teacher stated, I will not have my children maintain their mask on because the mask prevents oxygen from going to the children's brain. So therefore, I will not be encouraging my students to wear a mask. What do I say to such a teacher?
Well, I think you should say to them that although it might feel as if they don't get sufficient oxygen, it's just a feeling because the oxygen that is in the air is the same oxygen that is on the outside and the inside of the mask. It's just that breathing is a little bit obstructed because you have something before you, but it's not reduced oxygen. It is the same oxygen. And you can tell her that it's safe for them to wear the mask, and maybe she should try it for a few weeks and see if the attention of the children is changing. See, just try it and see. But she can see it with herself. What is true is that persons who are asthmatic, because of the obstruction of the breathing, they might get a little bit shortness of breath. So you would see them taking it off now and then just to be able to breathe unobstructed. But that oxygen thing, that's not true.
Thank you. That's it for me.
Angela, your question, please.
Okay, thank you. Thank you, Dr. Virginia. This was a very insightful presentation, and it also highlights some of the common concerns. These questions I want to ask is not for me personally because I'm over the age, but the question is, what are the concerns of ladies who intend to have a child? Will this impact their pregnancy negatively if they take the vaccination?
No, no. What they do say is that, of course, you always have to be careful with pregnant women. If they are pregnant, of course, you have to be careful. If the seriousness of the situation outweighs the potential risk, then they vaccinate. But if you live in an area where you have no cases or mild cases or whatnot, you can even vaccinate pregnant women. But having the intention to get pregnant but not being pregnant yet doesn't put you at risk for any problems during pregnancy. Even with breastfeeding, they say that the gains of breastfeeding outweigh the risk of the vaccine being transmitted through breast milk. So you can tell them to rest assured that if they are not pregnant yet, that they can just take the vaccine. And if they are pregnant, talk to your doctor. Look at your situation. If you're someone who is at risk, maybe you have had different challenges with miscarriages or whatnot. Every situation is different. So have that discussion with your practitioner, with your family physician.
Thank you so much.
Great, thank you. Thanks.
Thank you, Angela. Thank you, Virginia. I have a question, but it's already 9. I'm scared to ask. My question is, if a person has already gone through COVID-19, they've already had the virus, they've already gone through everything, do they get a vaccine? Even if they're like, let's say 65 and above, would they or should they get the vaccine?
Yeah, because what they've also found out now is that persons who went through a COVID-19 infection, the immunity is not as stable as when you get it with a vaccine. So everybody who has had, and they haven't established prolonged immunity for persons who already had the disease. So whether you have had the disease or not, everybody is being advised to take the vaccine because you're not sure how well you are protected when you had the disease. And what they've noticed is that younger persons, the immune response of a younger person, it holds on a little bit longer, but other persons, your immunity wanes off. That's when you had the disease. But with the vaccine, you have a more stable response to the vaccine being introduced.
That question was dedicated to Cookie.
Mali, you troubled on.
Sorry, I'm really sorry.
Yeah,
I want to interrupt her. I know it's very late. Just one question. So I'm really sorry again. I'm taking away everybody's time. But Dr. Virginia, thank you so much. It was a wonderful evening. I'm so glad I joined. Was perfect day to be in there. That's why Dolly said it's going to be a very interesting evening. So now I understand Dolly why. But like she said, that you had the when you've already had the virus, you still take the vaccine, and the vaccine is so the vaccine promises you that you're not going to get it again, because there are rumors also saying that even with the vaccine, you can still get the virus.
Yeah, that was the same question that Felda asked. So although with the vaccine, you have a more stable immune response to the vaccine, and although you have had the disease,
it won't be that serious.
You will still be able to get it again,
right?
But it wouldn't be that serious. So the severity would be less. Yeah.
Thank you
so much. Yes.
Thank you, Hanisha. Thank you, Dr. Virginia. You were amazing. As you can see, everyone is very, very engaged. And I think if I don't stop it now, we can go on for another hour. But it is late. And at this point, I would really, really thank you. I mean, you really cleared up a lot of things that were, doubtful in our. So thank you very much on behalf of Sunrise and Rotary and all the guests.
Thank you.
Thank you, Virginia.
Your pleasure.
And please.
Pleasure to have been with you again.
Good
night, everyone.
Good night,
Good night. Good night.
Good night, everyone. Bye, Virginia.
Thank you, Suresh. Keep doing the good work.
Thank you.
Okay.
Thank you.
At this point, we're just going to go quickly into our upcoming events. I don't have exact, but from next month, from 2nd of Feb, we are going to have one morning and one evening meeting. So Feb 2nd will be a 7 a.m. meeting. Feb 10th, which is a Wednesday, will be a 7 p.m. meeting. Feb 16th will be a 7 a.m. meeting. So the morning meetings we are going to go back to our Tuesday morning meetings, and the evening meetings are going to still be on Wednesday because Rotary Mid-Isle meets on Tuesday nights and we do not want to come. And we have a special event on February 22nd, which is going to be a Monday, and it is going to be a joint meeting with Sunrise, Sunset, and Mid-Isle. So that is something that we are looking forward to. And board members, 18th of Feb is our board meeting. So any questions, any points you want to bring, just send it to myself or Damali, and we will make sure we put it in the agenda. And Jerna, you want to remind everyone about the Happy Dollars?
I have received from most of them actually, so.
Perfect. Hanisha?
If they want to do it again, they can go ahead and do it. But yeah, I think I have from most of them.
AGC Moore.
Thank you, Anisha, for your generous contribution. We really appreciate it.
Thank you. Thank you so much for including me. Thank you.
Thank you very much. Also, it was an inspiring presentation. And just to let Rotarians in St. Martin know that in Anguilla, we're getting our vaccine the first week in February.
Oh, nice.
I had a meeting with the health officials today, and we will see how the Rotary Club of Anguilla can assist in convincing the population to take the vaccine.